Welcome to Fairway Frank's Video Productions. Today I'm going to discuss my idea on how to improve on the American Health Care Act. Right up front I want to say I fully support the American Health Care Act and appreciate Congress putting some effort into trying to remedy some of the problems, many of the problems that were created by the Affordable Care Act. I will be discussing the Affordable Care Act's problems. Because of the similarities in the names, I am going to refer to the Affordable Care Act as Obamacare. It is not meant as disrespect, it is just a device I'm using in order to speak with clarity. A little background on healthcare in America. 36% of Americans receive their health insurance through government social programs, and these are mainly Medicare and Medicaid. There are 7% of Americans that receive their health insurance. Actually, they purchase their own health insurance. And this is the area where all the pain is being felt as a result of Obamacare. It's the group that were not allowed to keep the doctors they liked, the plans they liked. They did not receive the $2,500 per year premium reduction. In fact, their premiums in many cases, including my own, more than doubled and continue to go up at double-digit percentage prices each year. So that's where the pain is and why this healthcare issue is even a topic today. The largest group is the 49% of people who receive their health insurance from their place of employment as a fringe benefit of that employment, and I call that the employer-provided group. And finally, there are still 8% of Americans who have no insurance. I want to focus the discussion today on the two groups called the self-payers and the employer-provided. These two groups, if you combine them, obviously represent 56% of the population, and it's the total private sector health insurance marketplace. And it is the interaction between these two groups that I'm going to define as the design flaw within Obamacare. The self-paying group was created by Obamacare as a device in order to allow insurance companies to provide health insurance at reasonable rates to people with pre-existing conditions. And essentially it was forcing the healthy people to pay more so that the unhealthy could pay less. And if you're healthy, you may think that's unfair, but if you think along the lines that someday you may too become unhealthy and benefit from this design, then you may not think it is unfair anymore. However, the way the Obamacare law actually put this into effect, it was implemented in a very unfair manner. There's a death spiral within Obamacare, but it is not the one that people talk about. I mean, there is a little bit of an effect from this problem, the problem being that young and healthy people are not purchasing insurance because of fewer healthy people in the self-paying group. The premiums have gone up. When the rates have gone up, even more people have stopped purchasing health insurance, and steps 2 and 3 keep repeating, and people refer to that as the death spiral that's going to cause all of Obamacare to collapse. It is causing some pain, but it's not the significant cause, and it is only in the self-payer group, not all of the American healthcare market. The real death spiral that is going to cause the self-paying group portion of the healthcare market to collapse is what I call risk dumping, and I'll define that here. Employees that suffer a catastrophic illness or injury can no longer work, and because of that, they're also at the point in time having extremely high healthcare costs. Since they can no longer work, number two, they no longer get their health insurance from their employer. There is a law, COBRA, that allows an employee to stay on their employer's health plan for up to 18 months, but the caveat is they have to pay out of their own pocket the full cost of the employer's plan. Since they are out of work, they cannot afford this. Therefore, they go to the healthcare.gov website, they purchase an Obamacare plan, and receive subsidies to assist them in paying for their health insurance. So that results in step number 3, the unhealthy employee just fell into the self-paying group. Then to replace the unhealthy person who can no longer work, a healthy member of the self-paying group gets hired to replace them. This risk dumping is what is causing the death spiral and all of the problems in the self-paying group. There are numbers that bear out the effect of risk dumping in the death spiral. In 2017, the national average premium increase for self-payers was 25%, whereas for the employer-provided groups it was 6.5%. I'm restating the percentage of Americans, the population percentages of Americans in these two groups, so that if you wanted to do your own scribbling on paper, you could calculate the weighted average, which I've already done here. If we were to combine these two groups into one single private sector market, total population would be 56%, and the weighted average of these two groups now combined would have seen a national average increase of 8.8% in their premiums. That 8.8% is significantly less than the 25% that the self-payers realized in 2017, and slightly more than what the employers provided at 6.5%. And the reason for this adjustment is there's a lot more people in order to spread the risk. The Obamacare Act itself has the words shared responsibility in it. In fact, there's a shared responsibility penalty if a self-payer does not purchase their insurance. So the spirit is to share risk, and I think that combining these two groups does it in a much more fair way. A little more on the numbers. This is not a 2017 anomaly. Ever since Obamacare was put into effect, self-payers have seen double-digit price increases, and employers have seen single digits. So essentially, the little self-payer group has been shielding the employer-provided groups from the real cost of health care in America. Essentially, the self-paying group, 7% of the population, have become the high-risk pool for all of the private sector health insurance in America, and that is the unfairness of the Obamacare design. How do we clean up this mess? We eliminate the self-paying group, and we stop businesses from being able to self-insure. We take those two groups and combine them into a single private sector market. And businesses still purchase insurance for their employees, but rather than doing it as a isolated group of their healthy employees, they now have to pay what the premium would be calculated for the average healthiness of someone in that 56% risk pool. And then we'd have to bar insurance companies from offering plans to employer groups unless they also offer the same plan to those who have to pay for their own insurance. Otherwise, they would calculate the new higher rate that has to be charged and only offer it to the employer groups, and still shy away from the, on average, more unhealthy people who purchase their own health insurance. Immediately, self-payer premiums would go down. Big league, as our president would say. Self-payers would also get real health insurance and not just extremely high deductible catastrophic insurance. Unfortunately, employer groups premiums will immediately go up, but it would be minor league in comparison to the savings the self-payers would see, and I think the slides on the numbers bear that out. Self-payers would not need, because of the lower premiums, they would not need as much subsidies to pay for their insurance, and the American taxpayer will save some money. Employees in the employer-provided group today will actually see an increase in their costs, because I'm sure the employers will pass on their added costs in the form of more premium cost sharing and maybe even a little higher deductibles. Bottom line, this is an attempt to provide fairness in the American healthcare system, and it's an attempt to allow people to be able to afford to purchase their own health insurance because they will be given fair prices to do so. That will give them not only the ability to buy their own insurance, but the dignity to pay their own way through life. There's always a catch. The catch here, we already talked about, is it's going to cost businesses more, and they're not going to like it. They will pass it on to their employees. Their employees are not going to like it either. All I can say to those employees is, welcome to the wonderful world of Obamacare. You are fortunate enough to be being introduced at a time when the American Health Care Act is attempting to remedy a lot of the problems. The businesses who self-insured have had the flexibility of designing their own benefit plans, and because of this have come up with some creative ways to control cost. They will continue to do that. The good news here is now the people who pay for their own insurance will be able to benefit from these innovative cost-saving measures as well. I'm hoping that My ideas can make it into the law, but things are moving fast. So I've already spoken personally to my congressman. I've sent letters to my United States senators. I'm hoping that you find merit in my plan and will do the same thing. My blog and my email address are listed there. If you want to send me some comments, please feel free to do so, and thank you for listening.